There are a number of things I would advise vendors who are looking to sell their business to consider during that process. Of course, the commercial reality and getting a good, fair price for the practice they have lovingly built is one of them. Equally important is understanding what you want post the acquisition. What level of support and systems are you looking for to help improve your practice and guarantee the long-term success? And lastly, it's all about the relationship. Are you partnering with individuals that truly are like-minded and have a similar view to you as to how to best service your communities and your patients? These three elements are fundamental in ensuring you make a good decision that you can be happy with, not just on day one, but for the next 2, 3, 4, 5 years and into the future.
You've got this small group of professionals who understand what you're going through and you can discuss your issues with them. So we have a Facebook group, which is great. In most capital cities, about every 3 months, we'll have a dinner where we invite lead dentists, sometimes associate dentists and practice managers as well. Got one in Melbourne tomorrow night, which I'm looking forward to. And they come together and discuss referrals between practices, discuss what's been working in terms of patient management and recalls and that type of thing. And also what problems they've been having. So if there is a new material, if there's a new filling material we've been using, we can discuss how it's been going. And that seems to work really well.
Against my usual anti-corporate attitude, I sold to NDC because they weren't like the normal corporate, in my opinion. The people involved are very personable, they have a lot of integrity, they have a lot of knowledge about dentistry, which was surprising to me. And I just felt that they're a really nice bunch of people to be associated with. Partnering with NDC has given the practice an edge. It gives us an opportunity to move forward with confidence that we are providing optimal dental care, confidence that we are well supported from an HR perspective, from occupational health perspective. NDC do treat us as an individual practice, Richmond Fine Dentistry. They made a point right from the get-go that they select practices of value. Why go in and change things that are working? That seems to be their attitude, and in fact that is the reality.
Their help has given me back some family time, and I know that seems cliche, but I think when you reach a certain point in your life, time becomes a precious commodity that you can't buy.
Matched or would complement our philosophy of how we like to do dentistry. And having looked at 4, there was really only one, and that was NDC. There's probably 3 areas that were important to us in making the decision and what swung us towards NDC as opposed to other corporate buyers. The first one would be maintenance of autonomy. It was important to us that whomever we partnered with, that we had a strong autonomy in our management and maintenance of our practice philosophies. Second thing is willingness to not only maintain current technology and treatment techniques that we have, but invest further in that. And probably the third one was that Hugh Fleming Dentistry, and this is no reflection on those who are, but Hugh Fleming Dentistry has never been a preferred provider.
Well, I go home to a life now, not back to the practice, even though I'm not here. As a sole practitioner, I did spend a lot of time thinking about the practice and working on the practice. Professionally, I get to be a dentist again, and that's what I love doing. I'm able to enjoy dentistry a lot more. Physiologically, my heart rate was always high before, because you're thinking of multiple things, not just the patient, but is so-and-so doing this and that and whatnot, and have we planned for tomorrow? Whereas now I think there are systems in place for all of that, which makes it a bit easier.
They mentioned the clawback provisos, which worried me a little bit in terms of them giving me money and then taking it back. I liked that NDC had this middle way where you were part of a bigger business, but also they appreciated that you had clinical autonomy and you could run the practice the way you thought, the way it had been run previously and the way that it was run best, with their support in a lot of those areas like HR and marketing.